Hi everyone. We have one little topic we need to finish up before we move on to chapter 12. And this little mini topic is on the Yates continuity correction. Now, I just want to refresh your memories here. We use corrections when one or more assumptions for a specific test have been violated. And we do that to control for an increased risk of making a type 1 error. So just as a bit of a reminder here, a type 1 error is when you find significant results, you reject HO thinking you have found a treatment effect, but in reality, there's nothing there. All right, so you rejected HO when you should have actually kept it. All right, this is called a false positive. When you think you have something, you're celebrating. In reality, you have nothing. All right, and we really don't want to make those type 1 errors. So what do? When we discover that certain assumptions have been violated, there's at least an option of running some sort of a correction. All right, and the correction that we can run with a contingency test is called Yates continuity correction. So let's look at what needs to happen before we'll even consider using this correction. So the first thing on the list is that you have a 2x2 design. This means that factor A has exactly 2 categories, and factor B, your second variable, I should probably not call it a factor, but so your first variable has exactly 2 categories, and your second variable has exactly 2 categories. So right away, this tells you you can never use the continuity correction with a goodness of fit test. Why? Because the goodness of fit test only has one variable where you are collecting observed frequencies. Right? So the Yates continuity correction, again, is only considered for a test of independence, which is also called the contingency test. All right, and now you have learned that it has to be a 2x2. The next thing on the list is that the chi-square is significant. The test itself is significant. And the third thing is that you have at least one cell or category combination. Those two terms mean the same thing. You have at least one cell with an expected frequency less than 5. And just to refresh your memories, where do you find that information? If you look at your SPSS output and go to the table where you actually see your chi-square value and the sig value for your chi-square, you'll see the continuity correction. Look in that cell in the output file. Okay, look, not that cell, that table. Look at that table in your output file. And right underneath the table, if you look in the fine print, it'll tell you how many cells, percentage-wise, how many cells have an expected frequency less than 5. And if it says 0, then you don't even need to consider using this correction at all, right? Because you have to have the perfect storm. All 3 of these elements must be true, all right, before you would even consider using this correction. Now, I keep saying consider using the correction. You don't have to use it. Even with the perfect storm, you can opt out of it. And that's because there have been a number of publications that have argued that this particular correction is way too severe. And so you could, especially if using the Yates continuity correction, if it causes you to lose your significant chi-square result, then I would just not use it. And I would cite one of these papers that says it's too severe. And I've listed those papers, by the way, or at least one of them in my book, okay, in the chapter. Now, if let's say you use the Yates continuity correction and you keep your significant chi-square result, then, victory dance, right? Because even though this correction is very, very severe, it did not take away your significant test result. So you can report using it, right? No skin off your nose. In fact, it makes you look really good. Makes your test results look really good, really strong. Okay? So that's it for the perfect storm, the chi-square, continuity correction, and that's it for chapter 11. I'll see you soon for chapter 12.